Welcome to this explainer. Today, we're diving into something that is honestly a total game changer for how we think about well-being. We're moving away from that rigid, traditional health advice you're probably used to, and we're looking deep into the dynamic science of how organic behavior change actually works. If you've ever felt like health guidelines are just this exhausting list of impossible demands, or if you're just curious about how people actually change their habits for good, you are going to find this absolutely fascinating. Right now, the public health world is completely split on how to get people to change their habits, and honestly, that divide affects every single one of us.
So, let's jump right in and address the elephant in the room. Why does following top-down health rules often feel so incredibly frustrating, and why do they almost always fail to stick? I mean, we've all been there, right? You try to follow a strict diet or some intense new workout plan, only to drop the whole shebang a week later. We're constantly bombarded with rules about what we should eat, how much we should move, exactly what we should consume, and yet chronic disease rates just keep climbing. Clearly, simply barking orders at people and telling them what to do just isn't working.
Here is our roadmap for this explainer. We'll quickly cover the public health divide, the authoritarian health model, what health capital actually is, how we drive organic behavior change, a comparison of the two models, and finally, a new path forward.
All right, Section 1, the public health divide.
Think about this for a second. Historically, our health protocols were built to fight acute threats, like viruses, which required very strict universal commands. And hey, that made total sense for containing an infection. But as our biggest health threat shifted to chronic, lifestyle-related diseases, we basically just copied and pasted those exact same commands. We assumed we could just engineer population health by bossing people around. But what that actually did was create a massive clash between trying to artificially enforce behavior and understanding the actual social realities of how people live their lives.
Which brings us to Section 2, the authoritarian health model.
So, what is authoritarian medical health education? Well, it's essentially a top-down biomedical framework defined by prescriptive commands, risk factor reductionism, and a massive reliance on individual compliance. It literally treats health like a military boot camp, demanding that you just fall in line with expert directives. It tries to engineer population health by, well, dictating to people, treating well-being as something that is managed entirely through strict obedience to clinical benchmarks.
Now, why does this approach alienate so many people? Basically for three huge reasons. First, risk factor reductionism. It takes complex humans and reduces us to mere risk factors, like a BMI score, treating our normal everyday habits as clinical liabilities. Second, it relies heavily on top-down moralizing and, frankly, paternalistic guilt. And third, and this is the big one, when people inevitably fail to stick to these impossible rules, it blames their lack of willpower. It completely ignores massive real-world factors like chronic stress or financial hardship that seriously limit a person's choices.
Critics of this model sum it up perfectly with this quote: "Telling populations to alter behaviors without addressing the environments producing stress is akin to treating symptoms while ignoring systemic pathology. You simply cannot demand widespread behavior change while turning a blind eye to the social structures and material realities surrounding a person." I mean, if someone is just trying to survive high chronic stress, giving them a paternalistic lecture on eating more kale isn't just unhelpful, it's completely tone-deaf to the root cause of their situation.
Okay, let's move on to Section 3. What is health capital? This is where the paradigm shift happens.
Think of health capital like a bank account for your well-being. Developed by Professor Wagner Marcenes, this framework completely shifts the lens. It views health not just as the absence of disease, and definitely not as some moving target for constant behavioral correction. Instead, it sees health as a dynamic, cumulative stock of physical, mental, and social assets. And honestly, this is such an empowering shift in tone. Your health is a stock of assets you build up and draw upon to adapt, function, and actually thrive when times get tough.
So it really comes down to this: fear-based compliance versus asset accumulation. The old authoritarian model uses fear of getting sick and a whole lot of external pressure to force you to change your behavior. But the health capital approach, it's about naturally building up your personal and community reserves so that positive choices happen organically rather than through forced, anxiety-inducing compliance.
Which leads us perfectly into Section 4, driving organic behavior change.
So how does organic behavior change actually happen without anyone moralizing at you? It relies on three specific mechanisms: psychosocial buffering, intrinsic motivation, and structural integration. In this model, healthy behaviors aren't forced through guilt, they just emerge. When you integrate supportive social frameworks and personal agency into your life,
Making a healthy choice is no longer this forced, exhausting chore. It actually becomes the path of least resistance. It's a natural, logical outcome of living a flourishing life, rather than an uphill battle against your own environment.
This part is absolutely fascinating. Positive emotional states actually act as physiological buffers against adversity. Instead of fear-based messaging, which, by the way, we know spikes our cortisol and triggers anxiety, having a strong sense of purpose and deep social connections physically protects our biology. It organically creates an internal environment where your brain actually wants to make healthier lifestyle choices. It naturally fosters those habits without the need for any external policing whatsoever.
Let's put this all together in Section 5, comparing the two models.
When we stack these theoretical frameworks side by side, the contrast is kind of wild. Just look at the primary motivator row. The authoritarian model uses fear, guilt, and strict top-down prescription and drive behavior. But the health capital model, it relies on positive emotional states, social connectivity, and intrinsic agency. One model views behavior as a series of forced choices driven by compliance, while the other sees it as an adaptive response to a person's real-world reality. Ultimately, one blames you for failing, while the other tries to fix the context around you so you can actually succeed.
Finally, Section 6, a new path forward.
We have to realize that clinging to top-down behavioral commands fundamentally fails to address the root causes of chronic disease. The power of the health capital framework is that it finally relinquishes that ineffective paternalistic control. It prioritizes supportive environments over moralizing compliance. By focusing on organic behavior change, by actively cultivating our cumulative well-being, we can abandon the incredibly frustrating exercise of bossing people around. It transforms public health into a truly empowering strategy for human flourishing. So I want to leave you with this final thought. How are you investing in your own dynamic stock of physical, mental, and social health capital today? Think about your daily routine. Are you operating from a place of fear, just constantly trying to comply with strict external rules? Or are you actively building a reservoir of well-being, connection, and joy that makes healthy behaviors emerge organically? Thank you so much for exploring this vital shift with me on today's Explainer. Now, go build that capital.